my name's Amanda. I just finished wiping down my table so that we can do some medication preparation. I'm gonna grab all of my supplies for us to start. So I have some Ativan and epinephrine, and then we'll gather some transfer devices and some syringes and labels. So before I go any further, I'm gonna clean my hands and put on some gloves.
Amanda, got you those flushes you asked for.
So the next step after I do that is I'm going to take the medication that I'm going to want to draw up, and I'm going to take any dust covers off the top of it and clean it with alcohol. So this is my Ativan vial. Then I'm going to take my gray needleless prep cannula and attach it to my syringe. I'm going to pull up my amount of medication that I calculated.
All right, so Amanda has Ativan 4 milligrams to 1 ml. We want this to be a 1 milligram to 1 ml concentration. So if I have 4 milligrams in every 1 ml, I'm going to want 4 milligrams in 4 mLs. Which means I'm going to pull up 1 ml of my 4 milligram concentration so that I have my 4 milligrams. And then I want to make this 3 ml or 4 mLs total, which means I'm going to add 3 mLs of diluent to get 4 mLs total. And I've now got 1 milligram, 4 milligrams in 4 mLs, so 1 milligram per 1 ml concentration.
That I'm going to be needing. Get rid of any air. So after I do that, I'm going to take my green fluid dispensing connector and I'm going to pull up my pre-calculated amount of diluent that I determined to be needing to make my final concentration. Now we do have a pediatric dilution table, but with the drug shortages, the concentration pulled from the Pyxis may not always match that dilution table. So just be aware of that, and you might need to still end up doing your own calculation separate from the dilution table if the concentrations don't match. So then I would connect my saline to this side. And you can just pull from the bottom syringe, and if you need to give the saline a little push from top, you can to your final determined total volume for the medication. I would then put a red cap on it. Christina, would you be able to hand me one?
Sure.
Thank you. And after I do this, you would label the amount of medication that you have in here, so the milligram or microgram dosage. The final concentration that you prepared, you would initial it, and then you would date and time it for the end use time, which is an hour from preparation since it was not prepared under a sterile hood. So here's a medication label that I can fill out and put on the medication. So the next thing we're going to discuss is if we have to add a medication to an actual fluid bag. So for that we have some epi. Just cleaning up my workstation a little bit. So again, we would take our epi vial and we would remove any dust covers and we would clean the top of the epi vial. And actually, Christina, could you hand me a little bit bigger syringe?
Mhm.
Thank you.
Welcome.
So I would open my new gray needleless prep cannula. And I would draw up my pre-calculated amount of medication. At the end of this simulation, we'll talk about how to do the math to determine this. We get rid of any air. Potentially make a mess if you're me. And then what you're going to do is you would clean the access to your bag before putting in the medication. And then you can just instill the medication in. Now, I knew that I was going to add 5 mLs of medication to this bag, so prior to doing that, you would want to remove that 5 mLs from the total volume. So this was a 100 ml bag. I've already pre-removed 5 mLs, so it's 95 mLs of diluent, and I'm going to add 5 mLs of medication to it. And then again, you would label it with your final concentration, your initials, the name of the medication, the dose of the drug, and your end use time, which would be an hour from preparation since it was not in a pharmacy under a sterile hood. So now we will turn it over to Christina and she will show you the math that we use to get these calculations for how much med and diluent to use.
Okay, for those like me who need an example, when you're trying to figure out how much epi you need to draw up to be able to put in the volume or to put in the bag, you're going to do desired volume times your desired concentration equals your micrograms to draw up. So our desired volume was a 100 ml bag. Then we're going to multiply that by our desired concentration of 50 micrograms per 1 ml. These mLs cross each other out. Divided by 1 means nothing. So we're doing 100 times 50, which gives us a 5,000 micrograms is what we want total. Since we have a 1,000 to 1 ml, and that's Mike's, concentration to start with, that's going to mean we're going to need a total of 5 mLs drawn up from our vial, and that means we need to remove the 5 mLs of volume from our 100 ml bag. Now back to you, Amanda.
So I wanted to just change gears for one moment to briefly touch base on our new transfer devices that we have for blood draws. We will not be using the gray needleless prep cannulas for anything but med preparation. So what we have instead is we have these new transfer devices that we'll use to transfer blood that we draw from a central line or a venipuncture stick into the actual lab tube. So this would be my blood that I just drew from my patient. My lab tube, and my transfer device. So I would be able to just puncture my transfer, one sec. So my blood, I can screw into the top of that, and then I would be able to puncture my transfer device, and then the blood would suck down and fill the transfer device. For microtainers, we would still just pop off the top, and if this was my blood sample, we would just still drip it into the microtainer. And then we have our new lab reference guides that are posted in the units. Those will tell you how many times to invert a tube. Just remember that inverting is 1 time down and then 1 time up is 1 inversion. Thank you.